later on in life if someone will get diabetes. So type 2 diabetes is a combination of lifestyle and also genetics, right? So what starts to happen is that when your body doesn't make enough insulin to carry the sugar load from foods, as you can imagine, the sugar, once you eat, sits in your blood, right? So your body releases a little bit of insulin to take some of the sugar away so you can still function and use it as energy, but it's not enough to move the sugar to your cells where the amount of sugar in your blood is the perfect amount or the target amount, right? So as you can imagine, when you have blood sugar so high, sitting there for a long time, it starts to cause damage. And diabetes, I always say, affects your head to toe, because when you have diabetes, wherever blood goes, the sugar goes with it, right? Because the sugar is in the blood. So wherever sugar goes, wherever blood goes, sugar goes with it. So diabetes can affect any part of your body from head to toe, right? And so I explained that. So there's something called pre-diabetes, and a lot of people, I get a lot of calls about people saying, my doctor said my sugar is a little bit high, but I don't have diabetes yet. So we call that pre-diabetes or borderline diabetes. So borderline diabetes is when you don't have diabetes yet, but your sugar is increasing towards type 2 diabetes, right? So at this point, it's reversible. So if your doctor tells you you have pre-diabetes or you have borderline diabetes, it means that at this point it's reversible, meaning that all the good changes that you make in your life, it can reverse it, because at this point, it's not diabetes yet. And we use blood work. So when you go for your blood work, you go for lab, that's when we're looking at all the different blood sugar levels to see where you're at. So if someone is said to have pre-diabetes, it means that when you go for blood work and we check your, and we use different categories to monitor. So we check your A1C. Your A1C is like your 3-month blood sugar average. So all of us have red blood cells, and in our red blood cells, attached to our red blood cells are hemoglobin, and the sugars attached to our hemoglobin. So when we take your blood sugar, when we go to lab and we measure your hemoglobin, we can see how much blood sugar is attached to your hemoglobin, and that tells us how your blood sugar has been managed for the past 3 months, because red blood cells last in our body for 3 months. So every 3 months they regenerate, right? So when we measure your blood, we can tell where you're at in terms of your diabetes management by looking at how much sugar is attached to your hemoglobin. So we call that the A1C test. And when that and it's in percentage, so we measure it in percentage. So when your doctor tells you that you have borderline diabetes or pre-diabetes, it just means that your hemoglobin, the sugar that's attached to your hemoglobin, the target is anywhere between 6 to 6.4%. So that's how we know that you're in pre-diabetes zone. Whenever your A1C cross over to 6.5 and higher, that's considered type 2 diabetes. So type 2 diabetes is when your hemoglobin A1C target is between 6.5 and up. And then it's considered pre-diabetes if it's 6.4 down. And pre-diabetes is manageable. And you manage it and you reverse it with the same kind of things we're going to talk about here today. And then we have gestational diabetes. So gestational diabetes is the type of diabetes that happens when a woman is pregnant, right? So when a woman is pregnant, your body goes through lots of changes. There's a lot of hormonal changes, and sometimes this can lead to a person getting diabetes when they're pregnant. And usually when everyone that's been pregnant in Canada, when you're between 24 to 28 weeks pregnant, you go for blood work. And what we're checking, they give you a sweet drink to drink, and then you're there for about an hour, 2 hours, and we're measuring your blood sugars as you go. And what we're doing is we're checking to see when we give you that sugar drink to drink, if your body was to able to handle the sugar load. So that drink has about 75 grams of sugar in it, and we're trying to see if your body can handle that sugar load, if your body can produce enough insulin to move all that sugar load into your cells, so to know where you're at, to make sure the baby is healthy and all of that. So when we do that and we check an hour later, then we check 2 hours later to see where you're at. And that's just showing us that whether you have diabetes or if you don't have gestational diabetes or not. So if you don't have gestational diabetes, then it's good news. But if you do have it, we give you about 2 weeks to, kind of use diet and exercise to try and control the blood sugar. We give 2 weeks only because, you're pregnant, the baby's growing, we want to make sure you're safe and the baby's safe. So with gestational diabetes, it's treated with only insulin. So you can't treat gestational diabetes with pills because the pills is harmful to the baby. So when you're pregnant and you get diabetes, you'll be injecting insulin because that's what's missing in your body to help your baby grow healthy and for you to grow healthy, right? So some of the symptoms of diabetes, and some of the symptoms, some people get symptoms, some people don't. So no be all diabetes behind the symptoms. So we need all diabetes until so the doctor how man check, right? Because sometimes the body just doesn't show any signs of diabetes, right? So not having symptoms doesn't mean that you don't have diabetes. This is why it's very important that every year be out or doctor who now check it to make sure that you're doing your annual physical to make sure you're safe, right? Because some people don't have symptoms. Since it's the only symptoms that you think everything is fine. Into going to your doctor every year to make sure that you're being checked. Sometimes this is the way some people find out that they have diabetes, right? So it's very important to get our annual checkup. But some of the symptoms, some of the general symptoms of diabetes includes excessive thirst. Into or no thirsting all the time, but still they're not satisfied. That could be a sign of diabetes because what's happening is that sugar blood very thick, right? Sugar blood very thick, and because the sugar is high in your blood, your body is built to work in a balance. So whenever the balance is tipped off, that's when disease starts forming. So because your sugar is high, the body is imbalanced. So what your kidney, which is another organ in your body, trying to do is to get rid of the sugar. So our kidney is like the filter in our body, right? And its job is to get rid of all the things that are harmful inside our blood, to get rid of it. So we pee it out, right? So when you have diabetes and your sugar is really high, your kidney is working so hard to get rid of the extra sugar. And because your kidney is working so hard to get rid of the sugar, guess what? You're peeing because you can't pee out crystal sugars. In order to pee the sugar, it has to be dissolved in water. So you're peeing out a lot. So that's one of the symptoms. So people that frequent urination, they're constantly peeing all the time. That's a sign that your sugar could be high because your body's working overload to get rid of the excess sugar. And then because you're peeing so much, you're very thirsty and you're drinking lots of water. So it's like a cycle, right? You're very thirsty, you drink lots of water, but your body is getting rid of the water because it's getting rid of the sugar as well, right? So frequent urination is one. Fatigue. So fatigue means extreme tiredness. So when you're tired all the time, you don't know why, and you're getting enough sleep, but you're always tired, that could be a sign of sugar going too high. Because what's happening is that even though you have the energy from the food, it's just sitting in your blood. Your body's not able to utilize the energy from the food. So you're tired, right? So the sugar is in your blood as energy, but the energy cannot be transported into your cells for you to use it, for you to use it as the proper energy you need to survive. So if you're constantly tired and drowsy and sleepy and all that could be a sign of diabetes. Dry, itchy skin, once again, because your body's getting rid of a lot of fluid, so your skin becomes really dry and flaky and itchy. That could be a sign of diabetes, sorry. Blurred vision, so because the sugar can block the nerves that are allowing you to see properly, blurred vision could be one of the symptoms of diabetes, right? So your sugar, you're not able to see properly. That's another symptoms. And slow healing wound. So and no yet sign of it could be sign of diabetes, because what happens, they say usually your body is supposed to heal properly with the right amount of sugar in your bloodstream, but because of sugar level is so high, bacteria loves and viruses love sugar, so they will hang around the wound and they will just keep, and because they're hanging around the wound, it never heals, right? So, and also when you have diabetes, I mentioned that very thick, right? Because of moja very thick, it doesn't flow properly, so you have decreased circulation to the area of the wound, and also wound healing slows down. So these are some of the classic symptoms of diabetes. But like I said earlier, symptoms when it's very important that every day every year now doctor check you to make sure that you are safe, right? So I talked about the symptoms. So complications of diabetes, as you can imagine, because like I said, baby, a sugar number could be a moja number could be a sugar no. Into diabetes may affect the BI only per DM, affect our coma, affect our knee, affect our kidney. and affect your kidney a lot because your kidney no any filter a cleaning or blood, right? And the sugar near high, the higher the blood sugar, the higher the harder the kidney has to work. And because the kidney is working so hard to get rid of sugar, the the sugars are sharp and it can start to cut the filters in your kidney, right? So the filter system in your kidney starts to damage because it's working over time and working really hard to get rid of the sugar, right? So kidney is usually very affected by diabetes. Your nerves, it's like the communication system in your body, right? So your nerves start to get damaged because the nerves are being coated by sugar. So it's not able to work properly. So for example, so do diabetes and also be started so diabetes that sometimes it be feeling right? Because their nerves are being damaged and coated by sugar. So it causes numbness, and because of numbness, so feeling. So that's one of the also hallmark signs of diabetes, right? It causes nerve damages. It can cause oral problem. I know we don't talk about oral problems a lot, right? Like I say you will send out making sure so we take care of your oral health. We usually don't talk about that, but it's very important, and diabetes can affect that. Like I said, bacteria don't love sugar. And say if you have a lot of sugar in your blood, your gums you can get gingivitis very easily. And then if your gums can be very damaged, it can damage your gums. So it's very important that if you're getting dry mouth because you are super thirsty, because your body is getting rid of all the water and through peeing, it can lead to dry mouth, which can cause all kinds of bacteria to grow in your mouth, fungal infection and all of that, right? So mouth care, very important, and that's one of the signs. And also diabetes affects your vessels, right? Affects all the blood vessels in your system because the sugar is in your blood and the blood is in the vessels. And what happens, and they say, because of sugar, think of honey, a war. So a war is here 10 times. Sana say sugar level kosora umoja ne yetentai into move nicely like it's supposed to flow nicely to all the different organs and all the different vital organs in the body, right? Moja ne move there, but they move very slowly, right? And because it's doing that, it's damaging the vessels now. Moja ne it's damaging it, right? It's very important say you get your blood work done to make sure where you're at. And if you do have diabetes, you do all you can to manage it because, like I said earlier, it's manageable. And it also affects our heart because yakuma no ende pump emoja to the rest of the body. So our heart is like the pump in our body to supply us all the blood. So as you can imagine, if emoja na etintaya, wakuma no so extra hard to push the thick blood through all the vessels. In doing that, it can cause damages to the heart muscle itself, because the heart is a muscle, right? So in doing that, the heart is overworked, and it can lead to all other issues with the heart. It can lead to heart attacks. It can lead to strokes if it goes in the if we go to the brain side. It can lead to lung disease and everything. Just think of diabetes affects everything in your body, right? So whatever you're doing to manage your diabetes, you're using it to manage your whole body, in a sense. So these are the complications. I talked about it: the eye disease, the kidney disease, the diabetic foot. So there's a lot of damages that can happen to your feet because of the nerve damages. Atherosclerosis is when your vessels becomes hard. So atherosclerosis, your vessels become hard because of the thick blood moving through, and your the tube becomes very hard itself. So imagine you have a hard tube and you have sticky, thick blood flowing through. That's a recipe for disaster, right? So it can lead to, like I said, heart attacks and strokes and all of that, right? And then, so these are the major complications of diabetes. So if somebody have diabetes, this is what we're trying to prevent, right? The complications of the diabetes, because this is the side effect or the secondary effect from diabetes. So we talked about the complications. So the eye disease, neuropathy, which is the nerve disease, nephropathy, which is the kidney disease, and it can even lead to higher risk of developing Alzheimer's disease. Why? Because your brain is not getting all the nutrients and all the blood flow that it needs. So diabetes, once again, affects everything. So what are some of the things that we can use to manage diabetes, right? So same things that we do. So I always say there's no special way. It's just a healthy lifestyle. And this is not just for people that have diabetes. This is how we should all be living and, you know, watching our health. Because when we do that, it affects, it improves everything. So the ABCs of diabetes management, or ABCD of diabetes management, is looking at your A1C. So like I said, I explained earlier, the A1C is the test that we use to see where you're at in terms of where your blood sugar is, right? So your blood, every 3 months, we check if someone has diabetes. Usually every 3 months you go for blood work, and we're checking to see how your diabetes is being managed by looking at the sugars attached to your blood cells. So that's the A1C, and it's a 3-month blood sugar average. So if somebody doesn't have diabetes, and they have pre-diabetes, if you have pre-diabetes, that number is anywhere between, like I said, 6 to 6.4. That's pre-diabetes, reversible. If the A1C moved to 6.5 and higher, that's considered type 2 diabetes, right? So when you go to your doctor, and this is a very important number for you to know if you have diabetes, please know what your A1C is, because that's essentially your management report card. That's like your report card to see how your diabetes is being managed, right? So if you have diabetes and your A1C is between 6.5 to 7, that's excellent. That means your diabetes is being managed very well, and very little complications is happening in the body because your blood sugar is within target. If the A1C goes above 7, and this is in percentage, so if it goes above 7%, it goes to 7.5, 7.8, goes to 8%, 9%, 10%. The higher it goes, the more complications you can develop with diabetes, because it just means that your blood sugar is not being managed and your diabetes is not being managed and your blood sugar is very high, right? So this is different from when you prick your finger at home. So when you prick your finger at home, you're looking at your blood sugar at that one point. The A1C is looking at the average of your 3 months. So that's why it's in percentage. And then of course, blood pressure, right? So the B is blood pressure, making sure that your blood pressure is in check. And today we're talking about hypertension. And so I'll give a little bit information about blood pressure as well. So blood pressure is very important because if you have diabetes and you have high blood pressure, once again, it's a combination of disaster, because your blood, no, I say syrup, right? Umojana is a syrup. Umojana is a syrup, so I am very thick. Into umojana is thick because of sugar. No? Now, I know sugar umojana is thick. No? It's hard for umojana to move around, right? Because your also wakuma pump very hard to push the blood around. In doing that, no, amount of pressure right? So if someone has diabetes, their pressure is usually a little bit higher than the average person. Amount of pressure in this also hypertension, it makes the pressure even more higher. And because the pressure is higher, no, it can cause so much damage to the arteries and the vessels in the body, right? So it's important if you have diabetes that you're managing your blood pressure as well. And then C is cholesterol, right? Cholesterol, as we know, is the fat, right? So say, arteries, no, say, sadia dema, right? And you know, bit mama sadia da arteries, right? You know, arteries no they carry blood, and no na tuba you moja film. And this, as you can imagine, say moja na is very thick. First of all, amount of pressure because it needs more pressure to move around. Now cholesterol also air block tube na moja na. As you can imagine, it's very hard on the body because now no moja needs to flow free dada and tube no so block. You know, and non assets for example, say pressure now nobody wakuma also use pressure maybe pushy blood not through narrowed tube, you know, because the tube now is narrow because of cholesterol. And this a narrow tube now say a move press the pressure name move your friends say moja through arteries. Some of the fat can break off, some of the plaque, which is from the cholesterol, can break off. And this no be able now say a share or artery a supply brain. Emoja and only a stroke, so you can get a stroke from that, right? So if the plaque break off and it goes and gets stuck in an artery supplying the brain, it can lead to stroke. Say fat maybe so breaky and a plaque maybe so breaky. Never share there be in fact artery supply wakuma and also by block blood flow to your heart, and that leads to heart attack. That's myocardial infarction. So that's heart attack. And as a nubi subu never share or lungs and what, that's pulmonary embolism. And also another major, these are all major complications and life-threatening. Say big crochet friends say peripheral arteries supply your nine. I say supply your nine. Yes, home mojam. It is a no be a part ni be breaking up share baby. Yes, so be anya friends say DVT and I said blood clot a question and none block blood flow. And then no, it can cause pain to your calf and it can lead to decreased blood flow and it can lead to it's also life-threatening. So these are some of the life-threatening things if you combine the ABCs of diabetes. So your A1C, which means your sugar is really high, your blood pressure, and then cholesterol, right? So some of the things, so managing these ABCs can help you manage your diabetes and prevent the complications that I just mentioned. And of course, we're looking at our diet, right? The AD is so important, exercise is so important. So these are the management tips for diabetes or pre-diabetes if you have, or even if you don't have diabetes, right? This is how we should all be living, making sure that we're taking care of ourselves so our sugar doesn't go high, making sure, say, your blood pressure is under control. We're doing things to control it. We're making sure, say, our cholesterol is in check. We're eating healthy, we're exercising, and we're looking at overall health because we're not from head to toe, right? So now I'll talk a little bit, I'll put diabetes on the back burner and I'll talk about hypertension or high blood pressure. So hypertension, your blood pressure is what the pressure between your arteries. So when the blood is flowing through your arteries, the pressure it needs to push the blood, your heart needs to push the blood through your body. So that's your blood pressure. And the normal blood pressure is supposed to be it's supposed to be 120/80, right? So if your blood pressure is that's the target, right? So if your blood pressure is hovering around 120/80, that means it's good. And it's measured in two numbers. You have the systolic pressure, which is the top number, and the diastolic pressure, which is the bottom number. So it's measured in two because two things are happening. So your systolic is when the pressure that your heart used to push the blood to flow through your whole body, right? So that's systolic. That's pressure to push your blood through your whole body. And diastolic is the lower number because that's when your heart muscles are relaxed and it's filling blood. So when your heart pumps the blood, that's your systolic, which is the top number. And then the bottom number, no ne say wakuma na relax, ne feeling muja. So wakuma ne feeling muja, also pressure you low because it's not doing anything, it's just filling, right? So that number, that's why the number is lower. And then of course you need more pressure to push the blood through your whole body, and that's the systolic. And this is the target, the normal target for somebody that doesn't have hypertension. So if you have this or less, that's good. So if your blood pressure is usually like 110, 105, 1 over anything under 80, that's good. But we're considered to have hypertension if your blood pressure goes above that. So the normal is anywhere between 120/80. When it goes above 129 or 130/80, that's considered high blood. That's considered your pressure being a little bit elevated, right? So be what diabetes because of diabetes, no. Mark pressure, because of diabetes, no mark pressure, cost of so be diabetes usually no the target for blood pressure is different from diabetes. In diabetes, your normal blood pressure should be 120/80, right? But to be what diabetes, the target blood pressure is 130/80 because diabetes no mark pressure cost. This is why we have to be very careful and do the baby as a why not pressure. You're considered to have hypertension or is diagnosed when your blood pressure is above 140/90. So 140/90, if you don't have diabetes, it's considered hypertension, right? So so-called doctor now check your blood pressure. No, so blood pressure is 140/90. Right away, no, that one blood pressure, and then maybe you should get diagnosed. What we do, they say, why more relaxed? Not you and you bet your mom wants not hospital, not hospital, sorry, in the doctor's office, not yet check your blood pressure over 15 minutes. You better check your blood pressure over and over again over 15 minutes. And then the average, if the average is averaging over 140/90, then you consider to be diagnosed with hypertension. So it's never one blood pressure that we use to diagnose, right? It's multiple. And I say every time you have a doctor who be our blood pressure, no, high, then they can start you on medication because that's indication that your pressure is high. You know, to be diagnosed with hypertension, your blood pressure has to be 140/90. So we need diabetes. So what diabetes are? For blood pressure, you're considered to have hypertension if your blood pressure is 130/80. So we want it to be, because we want your pressure to be a little bit lower, or work towards a lower pressure, because I don't know about wow. So the complications of diabetes, high blood pressure, and found other problems, right? Anytime our blood pressure reach over 180, over 120, that's crisis. That means that there's a high chance of you to have a stroke. So whenever your high blood pressure leads to stroke, high blood sugar leads to stroke. So as you can imagine, that's why when you have high blood pressure and high blood sugar, it can lead to all the complications. So anytime we have a check of pressure, anything like going to 160, 170 over, especially the bottom number, which is when your heart is relaxed. So if your heart is not that, even when your heart is feeling blood muscle pressure near that high, that's very dangerous. That's a sign that you can stroke at any point. So anytime, let's say when things go back to normal, walk check your blood pressure, now it's very higher. I'm not trying to scare you. It's a good idea to follow up with your doctor. Jen says, oh, there's always a reason why blood pressure is high, but it shouldn't be that high, right? So for example, your 2 your pressure because say you no coffee, any certain things that your pressure cost. But if let's say so check it in a normal day, now checking say anywhere between 160 and up 180, it's important to book appointment right away, or go to like an urgent care clinic right away for them to take a look at you, because you don't want to leave it, because symptoms, right? Sometimes the symptoms because I never call doctor hunter, but no symptoms, right? So who said pressure was right, so make sure so check out to make sure you're safe to get the medication you need, right? So like I said, blood pressure is caused by so many things. Genetics plays a role. So all diseases, genetics always plays a role. So some people, they just have higher blood pressure. And before no, you compare before other ethnic groups now, before pressure usually was sort of more than other people, right? So being Black or being African descent, it puts you at risk anyways, right? So it's important for us to take care of ourselves. So some of the things that can cause blood pressure is narrowing of the arteries. So now you may explain it earlier, and say cholesterol level cholesterol. That's in fact we need diabetes, but cholesterol was through. Now and no ma two tubes now emoja ne fem no because fat no start na ada inside ntiama space na emoja ne move afa no ayeketwa. Nti because of say no na ayeketwa ebe ma blood pressure cholesterol, because wakoma need more pressure and san push it emoja ne through that narrow tube, right? So narrowing of the artery can cause high blood pressure, and that can also lead to atherosclerosis, which means that vessels are very hard, and a vessel also flexible, so blood can flow free. So vessels are very, very rigid and hard because of fat, and so the pressure also, and can lead to other things, right? So it can lead to heart attack. It can lead to increased heart rate, which is palpitation, right? Because your heart is working extremely hard to try to pump blood through to get to the vital organs. And sometimes other issues like having diabetes or having cholesterol or having eye disease or other diseases can lead to high blood pressure, because whenever there's disease in our body and things go unbalanced, and when things go unbalanced, that can lead to high blood pressure. Anxiety, depression, all of that can lead to can also affect our blood pressure, right? Because when you're anxious and you're in panic, your body restricts the vessels so we can move blood faster to your vital organs that you need to survive. So all these things, if it becomes chronic and we am all the time, you're depressed all the time, and those things happen, it can lead to other secondary problems like hypertension, diabetes, and all of that, right? So we have to be mindful that because it's all connected. The affected adrenaline affected nipaduane, the affected nipaduane so affected adrenaline. There's no two ways. So the baby okay, so for hypertension, it's important to get your blood pressure checked every 3 months. So hypertension, every 3 months, we'll check it to make sure say medication we'll take is working, and as I say, we'll take medication, lifestyle management now is working, because we don't want the pressure to be high over a long period of time. Every 3 months, especially with diabetes, it's very important to get your blood pressure checked every 3 months. Doctor, like I said, we do blood work for diabetes every 3 months. So every 3 months, you should be following up with your doctor or your diabetes educator or somebody. So, and they should be checking your blood pressure, and they should be checking to see where you're at, right? You know, you're checking now, if you say postura, then we have to put things in place. Usually, no, there's a name right? And we'll get into that soon. Right. So, like I said, if you have diabetes, we want your blood pressure to be 130/80 or less to help you prevent complications, right? So these are the management, and I should put management of diabetes and hypertension. So this is what you do when you have, if your doctor tells you, say, no sugar, you're careful. This is exactly what you do. So what diabetes are? This is what you do. So wouldn't need diabetes, this is what you do, because this is essentially the management for healthy lifestyle, which can help prevent all kinds of complications, right? See, and it includes stress management, healthy eating, physical activity, so doing exercise. Of course, if you're whatever your diagnosis, you take your medication or your injection as prescribed. If you smoke, you have to quit, because that one, there's no if. You have to quit, because smoking just puts you at a much higher risk, and the diabetes and the hypertension already put you at risk. So smoking on top of, if you smoke and you have diabetes, if you smoke and you have hypertension, that's a recipe for disaster. So smoking, you have to work with your healthcare workers to do your best to quit, because that's the best way. If you quit smoking, it helps reverse some of the damages that can cause smoking can cause on the body, like lung disease and heart disease and all of those things. And if you drink alcohol, you have to drink in moderation. So I'm not saying you can't have alcohol. I'm not saying that, stop drinking. If you stop drinking, it will help you. But if you do drink a lot, you need to cut it down to amount that will not cause any damage. And we'll talk about that, right? So in terms of stress management, I know with diabetes, usually doctor said no more exercise. Usually they don't talk about stress management. But stress, when your body is stressed, there's a lot of hormones that is released into your bloodstream. So stress could be stress from life, right? Like, your friends say, with the coronavirus being around, everybody's stressed. Like most people are stressed out being at home, kids are home or working from home, some are working. So there's a lot of stress. So whenever our body is under stress, remember our energy is sugar. We get our energy from glucose, which is sugar. So whenever we're under stress, our body is going to give us the energy to deal with the stress. And guess what the energy is? It's the sugar. So whenever you're under stress, your blood sugar level goes up. That's just what happens in your body, right? Because your body is built to take care of itself. So when you're stressed, your body goes, Juliet needs more energy to deal with this stress she's going through. So your body will release a lot of hormones that will cause your sugar to go up, right? Because it's giving you the energy you need to deal with the stress. But if the stress becomes chronic, meaning it happens all the time, you're constantly stressed out, that means your body is always in a stressful state where hormones, stress hormones are being released, and then also sugar. Managing your stress is a very important part of, healthy lifestyle and controlling your blood pressure and blood sugar. So stress, and also, anything that makes our body goes out of normal is considered stress. So if untimina is stress on the body, right? Because you're not getting enough sleep, your body is stressed out, and that your body will release a lot of sugar. If you have mental stress, that's stress on the body. So is stress on the body. So anytime we're in a stressful state, and yet the whole thing is a stress, stress. Sometimes people get diabetes because they're always stressed, right? Because your body is constantly releasing a lot of sugar into your bloodstream to deal with the stress, right? And that can lead to damaging of the beta cells, because your beta cells, which makes the insulin, is working extremely hard to pump insulin in your body to deal with the stress. So stress in itself can cause diabetes and high blood pressure. So yes, because BBI happening, that's normal. But if it becomes chronic, say that 3 hours, 4 hours, then you need to speak to someone to deal with the stress. And sometimes the stress, let's say it's like sometimes you don't even know what's stressing you until you go and speak to someone, right? Because like I said, they need the clients. Some say, "Do you have stress?" "Oh no, I think everything is fine. I'm doing okay." And then as we talk, then you realize that yes, they're very stressed because of, it could be, what's happening at their work, what's happening with their job, their finances, or maybe a family member is not well. MIS stress. And if you're stressed, it's very important. So, Dr. Bekasa, now diabetes educator Bekasa, to get the resources you need to manage the stress. But sometimes, all it takes is Bekasa about the equation and no problem. Wow, it releases some of the stress, right? And speaking to someone about it, we can send you to see a social worker that could help you with, talking about your stress and things that they can help you deal to manage the stress. Sometimes stress is something intimate. For example, it could be finances that's stressing you, right? Social workers have all the different tools, and if you speak to your diabetes educators, let's say it's medication that you can't afford, or things that's happening, you don't have coverage, you don't have other things that can help you manage your life. There's things out there that the government has put out there to help. We're there to connect you to all the resources out there to help manage, because we say stress, sugar cost, and our government says stress cost, sugar cost, when you diabetes, heart disease, heart disease, heart attack, hospital is a lot of money on the government to take care of you, right? So all these are put in place. So now in some pension, and I say even say bedroom oprana, the complications, because now maybe when you need more, like in your prime years, right? So that's stress management. So making sure that we're controlling our stress. And if you're stressed, don't be embarrassed. Say, why is stress? We all go through stress. Life happens. Nobody's life is perfect. We all go through ups and downs. And so if you're stressed, be open about it. Speak to be our trust, and then can say, who be a doctor, or no need to me because I know sometimes who doctor we need time or they better not see problems, but we better refer you to see an educator that can sit and talk to you and then come up with resources to help you, and as a social worker and as a psychologist, right? So sometimes the stress can bring on other mental stress, which can lead to mental diseases or mental illness, right? So stress can lead to anxiety, can lead to depression. It can, and then people have their own mental illnesses and stress, right? All that combination can lead to a lot of problems. So who go through the don't think say I know say because I am more than a psychologist. That's not why they're not there, because there will be cancer, oncologist specialist, diabetes, an educator, and endocrinologist. There's specialists for each part of your body to help you. To say if the stress is mental stress, it's anxiety, it's depression, it's schizophrenia, it's seasonal affective disorder, bipolar disorder. These are all different mental illnesses that are out there. If it's that now, and then you just like any other yalibia, you have to see a psychologist or psychiatrist, and then they can use therapy to help you and medication to help you manage. Because what happens with mental illness, and they say, it's not because of say, it's imbalance. Everything that happens in our body that makes us ill is imbalance. And you say, we will, friends say depression, because there's imbalance in the hormone that regulate mood, right? We do anxiety. There's also chemical imbalance. So there could be serotonin, dopamine, epinephrine. These are all chemicals that help stabilize our mood and our memory and all of that, right? So when those are in balance, that's when people are diagnosed with different kinds of mental illness. No, it's imbalance, and sometimes in order to get the balance back, you have to put it there. So you have to take medication that will help your body make those, help you make more of those hormones that can help stabilize your mood, help so you can go back to functioning a healthy life. So taking medication for anxiety, depression doesn't mean that you're crazy. It's just that's what your body needs. And I want to put it out there because so we are and we don't want to help them, but that's what it is. It's imbalance in chemicals, just like diabetes. It's imbalance in insulin. Same thing, right? So that's that. So stress management, very important. And then of course we go to diet, and then we go to diet. So what we eat is very important, right? What we eat is very important. And actually, before I do that, let me talk about exercise. So when we talk about exercise, exercise is one of the good management of everything, because when you're exercising, your body is releasing chemicals. I call them the feel good hormones, which are the hormones that I just mentioned that works on your brain, right? So the dopamine, epinephrine, serotonin, these are hormones that when you exercise, your body releases it, right? So when you exercise, your body releases anti-stress hormones that help you manage your mood and stabilize your mood, right? And, the way exercise, and not only is it helping your blood pressure, not only is it helping your diabetes, it's also helping your mental health, which is, it goes hand in hand, right? So if your stress is under control, then your blood sugar will be under control. So when you're exercising, think of it as you're doing your whole body a favor. So exercise causes you to release the feel-good hormones to manage mental stress, anxiety, depression, all of that. It also helps you release, use up the sugar. So when you're exercising, you're using up the energy because you need energy to exercise. And the energy, like I said, is sugar. And he said, the more exercise now, the more sugar now body, more sugar now body burning, right? So meaning that you're using up the sugar that's sitting in your blood. So the more exercise, the better it is. And to exercise, in order to consider as exercise, it has to be at least 10 minutes. So yeah, 95 minutes is good for you, but to count towards your exercise goal, make sure say, 90, and I say, bike riding, and I say, jog or treadmill, so at least 10 minutes for it to count. And the recommendation for exercise, aerobics exercise, which is exercise that increase your heart rate, like dancing, jogging, swimming, walking, if it's wintertime, shoveling snow, mowing the lawn, all those kind of exercises. It's called aerobics exercise because it causes your heart rate to go up, and it causes your blood to flow fast, and you use a lot of energy. So those exercises, you need about 150 minutes per week, right? So every week, try to make sure, say, 150 minutes. So if you break it down to 5 days a week, is 20 minutes. If you break it down to 5 days a week, it's 30 minutes, 5 days a week, right? If you break it down to every day, 20 minutes a day. 20 minutes a day is all you need to meet the minimum. So we will be able to meet 20 minutes. We have 10 minutes and why 10 minutes a minute. So at the end of the day, you have total of 20 minutes. So at the end of the day, you want total of 20 minutes of walking, 20 minutes of biking, whatever exercise you like. If it's dancing, that's what you do. Whatever exercise you can do that. And especially now with the COVID, it helps us also with our mental stress, right? To get out there, do some exercise. And if you can't physically go out there, time yourself at home. Make sure you're getting 20 minutes of walking around or jogging around or dancing every day. That helps you with your mental health and your blood sugar. Another type of exercise that you should also do is called resistant exercise. And resistant exercise is the type of exercise where you are working, type of exercise where you're working against your body weight or working with weight, right? So against your body weight, if you're doing push-ups, sit-ups, all of that is good for you because you're working your muscles, right? And when you work your muscle, you use up the sugar that's sitting in your blood. And when you work your muscle, the muscle get more sensitive, so insulin can work properly to move sugar into your cells to use it as energy. So resistant exercise is, you don't have to do it every day. At least 2 to 3 times a week you should be doing that, because then it helps build muscle mass. And when you build muscle mass, it helps burn fat and it helps control your blood sugar, right? So you can use weights to do, and they don't have to go buy weights. It's not the amount of weight, it's the correct exercise. So making sure that you're doing, so if it's bicep curls that you're doing like, let's say 10 reps, making sure you're doing it properly. If it's leg kicks that you're doing it properly, to making sure that you are getting the exercise. And if so, you'll be fine. So you use wheelchair, and also you use poma, and I say, exercise. Sit chair exercise counts too. Chair exercise. So I can do some exercise. I can do my leg lifts. So any movement to be able to make it be and I also my joints. As we age, our joints get stiff. So also our joints don't get stiff, right? Because stiff joints can lead to inflammation, which can, of course, lead to like pressure going up and all of that, right? So think of anytime, anything happens to your body, it can cause other problems too. So resistant exercise 2 times, 3 times a week. Make sure that you're doing that just to help your joints and to build muscle mass to help you use the energy better, right? So we talked about the ABCs of diabetes. I talked about the A1C. So at this point, I just want if you'll be a friends say diabetes, making sure that you are getting certain things checked is very important. So making sure you're going for your 3-month checkup is important. making sure that certain tests are often, right? So we need diabetes every 1 to 3 years. Every 3 years, the doctor will check their cholesterol. It doesn't have to happen often. But for diabetes, it's important to get it checked more often. Every 6 months to a year, you should have your cholesterol checked. Why? Because we're trying to make sure that your arteries doesn't get blocked, to make your pressure go high, which can lead to heart attacks and strokes, right? So we're preventing the complication. So if you don't have diabetes, making sure that you're going for your annual checkup is good. If you have diabetes, and your doctor will remind you. But I want you to know, say, sometimes you have to be your own advocate, meaning say, and now say my doctor now say, "Bibi or my doctor now for me." No, sometimes things get missed, right? Because doctor or patients be any patient, right? It is sometimes now, if you grab a blood work, now sometimes there's some abnormal blood result. But remember, anything can happen. Sometimes maybe I'll call your blood work, that's our doctor and friend. Who bet my friend? So call your blood work, no result you're saying. It's important to know where you're at, because you have to be your own advocate. Because sometimes some doctor people are BB, I have so and yet that serious in but it's not up to him to decide, because we'll be in a genetic background, right? Sometimes we know what diseases are in your family. So certain things you don't want to wait, right? And it's important for you to be on top of things. If one no checkup about checkup, or blood pressure time and check. So cholesterol maybe that if you 40 I'm a doctor check. So you'll be a heart disease running in your family. Get your cholesterol checked even as early as in your 30s to make sure say you're safe, right? Until say people wanna bit my then now I get they are born on mine. That's that, and also so making sure say your friend saying or diabetes when you get to when check it every year be check when it's free, or diabetes now need drug plan now check when it's free, because the government now said the bear, because when you say diabetes affects the eye, can lead to blindness. And when a person becomes blind, they become dependent, they have to get more resources and all of this, or put it in place so that we are getting any check. So only diabetes once in a while, like every 2-3 years, you can get your eyes checked. But over diabetes, every year you should get your eyes checked to make sure say that the sugar is not damaging the eyes. And even if it's starting to damage it, then something can be done early to help prevent eye disease, right? So it's important when you have diabetes to make sure that you are taking care of yourself properly. Okay, so I'll go back to, now that we're done talking about this, I'll go back to our food, right? Because most of the time we'll be up so okay, so more diabetes, mini diabetes, so there's no special diet. So what diabetes, so we need diabetes, so there's no special diet. Diet and I say meaning say you're grouping into groups, right? As you can see on the screen. And it says diabetes food guide, because we have arranging it, said they did make sense in terms of turning to sugar. So this goes for everyone. This is not for just people with diabetes or pre-diabetes, right? And as you can see at the bottom here, it says carbohydrate foods. So the carbohydrate foods in idea and my energy. And our body digests it into sugar, right? Meaning say sweet. Say the way I make here it breaks down into sugar, into glucose, right? In the energy, our best survival. Okay, so that's all your grains and starches, all your fruits, all fruits, whether it's sweet or not, has natural sugar in them. And then all your milk and alternatives, milk, yogurt, kefir, all of them have natural sugar in them. And like I said, all your grains and starches. Since so what did you buy? And that's what sugar. That's what person who be a beboa, and no, what's your share amount. Right, because I know your body, it breaking it down into sugar. It is that means say it's not to say and also a amount of ID. And then just say intimate and only near energy film. It's why this time anyway out in survival. You cannot live a normal healthy life avoiding your carbohydrate foods. You cannot. I know so there's so many diets out there about low carb diet and no carb diet. That is why for a while, but eventually you go back to eating, because that's just how That's just how we are. We need our energy from the food. So best and they say ubedi kakrebi. Now we need bebre. These three groups, no bedi ubedi kakrebi, we need bebre. And I wear vegetables. Vegetables, so they give us lots of vitamins and minerals and all the nutrients that we need for our body. So it's also important. And as you can see, also rainbow now, over picture now, vegetables, no, and a soup. So it goes as how much you should have. So you should have more vegetables and grains and starches. You should have more vegetables than fruits and fruits. You should have more vegetables than milk and alternative. You should have more vegetables and protein foods. You should have more vegetables than fat foods, right? So this is the food groups because vegetables, you know, has lots of benefits. A vegetable has fiber, and what fiber does is, you know, it helps lower your blood sugar level. Fiber acts as a broom, and not cleaning or addressing all the cholesterol. So we do fiber it help clear cholesterol, right? So it acts as a broom to sweep the plaque and cholesterol from your artery. So that's why it's important. We always say eat your vegetables, right? Because you get a lot of benefit from fiber. And because of fiber and intino, so we do fiber or body no use lots of energy to break the food down, right? So me did more na more no fast me did move and move it na vegetables to be ankanwa. My body bit might break it down and more into sugar within an hour, 2 hours. And then it can burn it quickly, and then within 2 hours I'm hungry again. But say me did the same amount of rice, you know. Now me the vegetables come home. Maybe a rice instead of saying me choose white rice, me choose brown. Brown no more fiber. Me did the same amount of rice, because of the vegetable come home, not fiber woman into no. Ebe mama may more because fiber no my body didn't digest the sugar not very quickly. It does it slowly, so the blood sugar is released slowly into your bloodstream. And in doing that, right? So you don't overeat. And vegetables should be paired with everything that we eat. And our vegetables, because like I said, and then there's so picture and then vegetables, 2 handfuls. So we did lunch and dinner. 2 handfuls of vegetables is sufficient enough, right? So so no less, 2 handfuls or more. Because the more vegetable you eat, the more you're going to be full. And I would do more vegetables. So I know so best stop would need so much of rice and pasta and other things. Yes, I know, but amount. You have to be very mindful. Say everything you're eating, you're adding vegetables to it. Sometimes some of the way we cook, the vegetables fry instead of when we're eating, we're getting more vegetables that way. So it doesn't have to be in salad. A bit my soup. So we get soup. You can introduce a lot of vegetables in your soup. You can have it as vegetables. You can have it as cooked. You can have it as raw. However you choose to. It's up to you, right? But make sure that we include vegetables, 2 handfuls or more, and that's a half of your plate. For example, half of your plate should be. Until the plates, so plates near. Half of it should be vegetables. What you are saying, and then maybe I would dinner with the vegetable. I can't make sure that half of the plate is vegetable. So which plate in half, that's a vegetable fine. You only have so much room to use to put the other foods, right? So then the other side, the other quarter will be your protein food, and then your carbohydrate, which is your grains and starches, which is rice, pasta, fufu, and more, benku, all of that. Brain this morning. I apologize. You're about the near. So 1 second. Let me share my screen. Okay. Okay. So can you see my screen now?
Not yet.
Okay, so can you everyone for me, please?
Um, say it again, please.
Okay, now can you see my screen?
Yeah.
Okay, perfect, perfect. Okay, so that may come about and how it should be, in terms of, and I brought this plate just to show, in terms of grains and starches, like I said, vegetables, no, half our plate should be vegetables, and then we have our protein foods, and then we have um, our, our, our starches, right? In terms of starches, no, aduane bi a wopɛ sɛ wodi mfa nsa Ghana aduane bi a wopɛ sɛ wodi bia no, I always say sɛ wobɛtumi di. There's no food that's better than the other, right? Nti sɛ, for example, sɛ aduane na wobɛdi sɛ mo na wobɛdi sɛ fufuo na wobɛdi banku na wobɛdi a ne nyinaa no ɛyɛ amount no. So obi wɔ hɔ sɛ womede meni fufuo because fufuo ɛnyɛ healthy and I say it's not good for you, right? Remember, starch is starch. So protein, starch. So udi banku, udi fufu, udi apesie, udi emo, ni nyinaa no starch, right? And in the best, and they say, oh, choose starch, more fiber. For example, so ubedi, in terms of so ubedi more, emo no, udi brown rice are better than white because white rice, you know, and no has less fiber, right? So the more fiber it is, the better it is for you. So udi brown rice are better, but then just because of the udi brown rice, into bit more. It's the same amount, right? So in terms of grains and starches, we are bit measure as a measure about abros 1.5 cup. So 1 cup, so the size of your fist. It is we are on face. That's how much you should be eating in terms of your starch, right? So se benkuna wudia. The main I mean the benkuna kwa me benkuna so che mensa. Say fufu na wudia ni kwa so che say. Say aduane bi a obedi bi a obetimi dey won sa atoto hu bia no, it should be about the size because the size of your fist is how much you should be eating. For example, say usually mema eat more because, for example, say mema one is say that's an instance of chemia. Means me need the same amount because the energy now my body here less because my body it's like I don't have as a large muscle mass. So you eat according to your body size. In this own person measure just rough, make sure say half of your plate, you have it, you have some vegetables, you have your grains and starches, and then you have your protein food, right? So grains and starches, now so I want to measure, maybe to say bread. Bread, to me measure two slices of bread is sufficient. So we do breakfast at 2 slices of bread is sufficient. For example, things like oatmeal for breakfast. Oatmeal is very healthy because it has high fiber and not fiber. Not only there's different kinds of, there's 2 types of fiber. Oatmeal or fiber, now it helps clear cholesterol. It is a we will be our cholesterol, what's through, and I say we will be our opposite. We need cholesterol runs in your family and you making sure that you're including oatmeal into your as part of your meals is also good. You don't have to eat it every day, but once in a while you can. That could be part of your meal, your routine foods that you eat, right? If you're choosing bread, choose breads that have lots of fiber, right? So stay away from white breads because it gets processed. Your body processes it very quickly into sugar. And in terms of things like protein, so protein, you can get protein from animal source, which is your meat, your fish, your egg, all of that, or you can get protein from plant source, right? Plant source protein include your seeds, all your nuts, lentils, beans, all of them have protein, right? So, and because of say air from plants, it has fiber. And because it has fiber, it can help clear your cholesterol. It can help you stay full longer. So that means you're not overeating to control your blood sugar level, right? So if you're going to eat, you don't always have to eat meat all the time. You can choose some of the plant protein to help you, especially snacking. When you're snacking, you can snack on nuts and seeds, right? So obetumi say snack and say bi amfa say apple bi na wafa na say ope protein bi aka ha obetumi afa some seeds. It could be sesame seeds, could be sunflower seeds. Any of those seeds are healthy. It could be any seeds that you like, right? Or nuts. A bit might say almonds, cashew, Brazil nuts. Any nuts that you like, you can combine because nuts is protein and it's good for your body because it helps hair, our teeth, and all the muscles. So we need a balance of everything, right? You know, who choose protein, choose some of the meat, you know, so who choose lean meat. Lean nature say fat in the because sometimes you know fat na one nam and the mere cholesterol cost. You know, make sure say you were choosing lean meat, say the bear why, and now once in a while, like maybe twice a week, choose protein and nam from plant source like nuts and seeds. Say the bear and also with your cholesterol management and blood sugar management, right? So everything we're doing in the balance. So it's not one way or the other. It has to be balanced. Wouldn't mean your vegetables and expect to be healthy. That's not it, right? Because as you can see in the food group, you know, I have other, like there's other things, right? It's not just vegetables. You can't just eat vegetables. There's nothing wrong with the Ghanaian foods. I always tell people because no. Like just now, no, because of some diabetes, no, and also because of some you have to make sure say who did the best of our foods, right? And for example, fufu, like I said, make sure say and bigger than the size of your fist. You know, say fufu, adia kasema reduce amount and over kakran. So a friend say more na would make sure say what the salads and I said what western vegetables they are. Sometimes no problem, no, vegetables are flat more into when you scoop the rice, you already have vegetables in it and then you can add more, right? So the bear because we know and quick fix. So it's not like, you know, I'm gonna eat very well and then go back to my normal eating. This is a lifestyle management. So this is something that you should be doing all the time. So because of its change and it's something that you should be doing all the time, it's important to obey it slowly, right? You know, as a mother now, as a father, as a fear now, they would know moody into the ocean or mususia, into kakranka. So when you'll be a moody with vegetables and kakranka, a bit my they get used to it, right? So you don't all of a sudden change everything, slowly adds to it. And then the same foods now, but just adjust it better because usually, you know, see you do more. Usually you do more no plate, yeah, opposite. And more no plate near the vegetables get to it should be the opposite. We should have the vegetables more, not more no can. Of course, then you can add your other foods. As you can see, I brought different types of foods for you to see. Say, you need now just make sure say, we place it better. And vegetables, no, so no, yeah, vegetables are yeah, tidy more. Spinach is excellent for you. Okra is very good for you. To say, oh yeah, I'm quite not ready for spinach and then okra maybe. I'll bet you add it to your soup. Like you don't have to add it to all the soup, right? But same thing. You can include okra into your foods, and this way you're getting some vegetables into your soup, right? So everything make sure say how can you include vegetables so the more balance. That's the most important thing. So the energy, but also it pairs up with lots of vitamins and minerals that your body needs to survive. So make sure say we are including everything. So and then we also have our milk and alternative. So milk and alternative, yogurt and milk and all those things. The milk, is important for our health too, right? So I know say milk and say milk, so we don't do that, which is fine. But then in between your meals, for example, so you'll be for snack, you can have yogurt for snack, right? You can have yogurt, throw some nuts in there so you have your carbohydrate and your protein, right? So then you get the calcium from the milk and the yogurt that you need for your bone health. Especially women, we need it for our bone health because menopause, when we hit menopause, our bone density goes down. So we need it. We need to build our calcium while we're young so that when we get older, we don't get brittle bones, right? So make sure that you're including your milk and alternatives into your diet is important. And then of course, also fat, fat, you need a little bit of fat, but you don't need a lot. So it's not good for you. Remember cholesterol, you just need a little bit of fat. But fat, so choose it from healthy fats. For example, avocado, it's a fruit, but it has lots of fat in it, right? But it's healthy fat. This kind of fat helps lower your cholesterol, right? Because all cholesterol are not made the same. You have bad cholesterol and you have good cholesterol. So you want to use to boost your good cholesterol and not bad cholesterol and cough. Because bad cholesterol LDL. So LDL is like the bad cholesterol that can lead to plaque formation or and then can lead to that, right? So watching and all those things not happening. But good cholesterol, only HDL, which is cholesterol, no help move bad from lipid, right? It removes the bad cholesterol so you can get rid of them. And good cholesterol are found in foods, healthy foods like avocados. They're found in flax seeds, healthy grains and starches like quinoa. All of these have healthy fats. If you want to use a healthy fat like olive oil, all those nut oils have good fat in them, but of course you have to use very little, right? Because fat has a lot of energy, which means that it can make you gain weight, right? So you just need very small amount of fat in your food. So if you're cooking your food and like things like fish that you're cooking with, make sure you bake them. The fish has good oil. If you bake it, you release the good oil that helps lower the bad cholesterol, right? So fish oil is good oil, but necessarily right? Make sure that we're baking our food, like we're baking our fish, or even if you feel to have fried fish, once in a while, you can pan fry it, meaning you put a little drizzle of oil and then you pan fry it, not deep fry where you have a ton of oil and then you're deep frying your food, because that destroys the food. So that's the diet. So I know this, I've talked a lot, so I'm going to leave it for people to ask questions. There's more for me to talk about, but usually I'm on for a question now. It will give me teaching points to clarify and then give more information as well. So I'll leave it here and then I'll open it up for anybody that has any questions so we can have more of a discussion and I can address any questions that you may have. So can you, I don't know if we're going to unmute people to ask questions or if they're going to put it in the chat. So either way, I'm good. I'm okay with it. So however you want to do it, it's fine. So if so a question, I'll bet me unmute yourself or the host can unmute you, I guess. If you can unmute everyone, so then if they have questions, they can unmute themselves to ask the question. So we can...
Hello.
Hi.
I have a question, please. When you were talking, I was wondering why you never addressed low blood diabetes, because I've experienced low sugar, and one of them even led me to the hospital.
Okay. So, well, I can explain low blood sugar. I didn't address it because this was like a general talk on diabetes, and so not everybody on there has diabetes, but you're right. When you have diabetes, there's high blood sugar and there's also low blood sugar, right? So just like with sugar, it can also go very low to a point where it could be dangerous. And we call that hypoglycemia. So that happens. So for example, we will be our diabetes, we'll check sugar with you. So we'll check sugar with you now diabetes. Before I obey sugar no targeting between 4 and 7. So this is not the same thing when I was talking about the A1C. This is when you prick your finger at home. As I will check sugar with you. Anywhere between 4 to 7 is considered the normal target for before food. And as a Uber cell check sugar, so after food, wait 2 hours because that's how long it takes your body to process the food. So if you wait 2 hours, now check your blood sugar. Anywhere between 5 to 10 is considered normal blood sugar after eating. And having said that, so sugar no go lower than 4 because, like I said before, I already didn't know. So sugar need between 4 and 7. So it could lower than 4. That's considered too low, right? Because our body is built to balance. And when it's too low, it's not good for you. When it's too high, it's not good for you. But when it's too low, it can also lead you to, like you said, emergencies. Because when sugar not drop from too much, that means your body can't function. Because in order for your body to function, your sugar has to be above 4. As the sugar continues to drop lower than 4, it got 3, it got 2, it got 1, that's danger zone. It can cause you to pass out. So sometimes, so who are diabetes, not say, what time I was time now you can feel the symptoms. Some of the symptoms of low sugar is when your fingers are trembling, so you're shaking, for no reason. You start sweating, right? But you're sweating. You feel very anxious. You feel extremely nervous. You feel very hungry. You feel like something bad is going to happen. These are all signs that your sugar is dropping too low. And so you'll be now with diabetes. That's a feeling some of these symptoms. Now, it's very important to test your blood sugar. Or test your sugar. No, that's a sugar lower. Then what you need to do is that you need to put the sugar there because that's what's missing, right? And this time, this is the only time when you have diabetes, I will advise you to drink juice. Because when you have diabetes, the liquid you should be putting in your body, or any of us, the liquid we should be putting in our body is water. But so sugar drop, that's when you need to put concentrated sugar into your bloodstream. Into juice now, half a cup of juice, right? Regular juice, not diet juice. And I say, we need juice. That's all sugar, pure sugar. A tablespoon of sugar in water. Now I know. And no sugar number. So it will prevent your sugar from dropping too low. So we need sugar now or honey. 1 tablespoon of honey is equivalent to the same amount. So you're trying to get 15 grams of carbohydrate, right? So at that point now sugar they drop you 15 grams. So a tablespoon of sugar, a tablespoon of honey, or if you don't have that, now we'll juice half a cup of juice or half a cup of regular pop, not diet, regular pop will give you the same amount of sugar. So we need to be now with glucose tablets. So what diabetes that most people know about Dex4. Dex4 is a sugar pill. And that sugar pill, you take 4 of them when your sugar is under 4. So that's the way for you to remember. The name of it is called Dex4. It's glucose tablet. Oko grocery store, you don't need prescription to get it. Oko grocery store, I'll bet many be. Any pharmacy they have. Catch them so sugar tablet. It's big tablets. You need about 4 of them when your sugar is under 4. So Dex4, when your sugar is under 4, you take 4 of them. And that gives you about 15 grams of carbohydrate to bring your sugar up. Because with sugar go too low, what happens is that your body is you don't have enough energy. Your heart can go into tachycardia, means your heart rate can raise so fast that you can pass out, right? You can pass out from the low sugar. You can go into diabetic coma. This is all from very low sugar. It can happen with high sugar. It can happen with high sugar too, but it's usually really, really high sugar. So if you have diabetes, my advice to you is, and this is very good question. Thank you for asking me this question. When you have diabetes, it's very important. Say, oh, fear, oh, just in case of sugar drop out with my grabber, right? So that's all juice now, in case of low sugar. And you say, oh, because sugar now, juice now, bring your blood sugar up within 15 minutes. Within 15 minutes, no blood sugar never bastro. A bastro now checking us a bastro, then about more than 4, then that means that your treatment, juma. And they say, sugar low, now checking us a lower, no more juice, no more take it, take it honey. Wait 15 minutes because that's how long it takes your body to absorb the sugar into your bloodstream. So we'll try 15 minutes and now check it. That's a cup more than 4. That means that treatment now, I work it. Then you eat, let's say if it's close to lunchtime and you eat your lunch. So near lunchtime, so maybe in between meals, have a little snack to keep your sugar up so it doesn't drop again, right? Usually this happens if you delay your meals, or sometimes people can, if you over-exercise, let's say you went for a walk and you overdid it, it can lead to low blood sugar. Or sometimes medication can cause low blood sugar too, like insulin can cause low blood sugar. If, let's say, you took the insulin, but you didn't eat properly, that can lead to hypoglycemia as well. So that's the other side of having diabetes. The sugar can go low and that can lead to other problems for you as well. Yes.
Okay, hi.
Yes.
Hi, so there are a couple.
Yeah, I'm listening.
In pregnancy.
Sorry, can you say that again? You were cutting off. I didn't hear you. Hello?
Unmute yourself.
I think he was trying to ask the question in the chat box. Someone is asking whether you can discuss high blood pressure in pregnancy.
Okay, sure. Okay. So I don't know which, if you want to ask me specific, but I'll do in general. So when you're pregnant.
Hi, Julia. It was me. I asked the question because With my daughter, I ended up getting congestive heart failure. So
Wow.
that means like the fluid in my body, it build up fluid retention, which
Yeah,
caused my heart to weaken.
yeah,
And I'm I'm expecting, but when I seen a cardiologist, which referred me to Mount Sinai. So
yeah,
Mount Sinai, they told me that I ended up getting postpartum stress because my body went through stress because I had to be induced with my daughter because I had high blood pressure.
yeah,
My feet were still swollen. So a
yeah,
whole lot of thing happened. So
yeah,
that's why I asked because they told me that chances are I would end up going through that again.
yeah,
So
yeah.
yeah, how do you address something like that? Because
So yeah, so unfortunately for some people, and like, and it goes back to your, like your overall health, right? So when women are pregnant, pregnancy is a stress on the body, and you're right, it's a big stress on the body because your body is going through so much hormonal changes, right? So when you're pregnant, this is why when you're pregnant, there's all these tests that you have to do while you're pregnant. Like you do the diabetes test for gestational diabetes to see, and then also your blood pressure. You're right. Blood pressure is another thing. So when you're carrying a lot of weight around the abdomen, which is the belly area, right? It leads to a lot of resistance in the body, right? So when you carry as the stomach grow, as the baby grow, it can lead to insulin resistance. It can lead to preeclampsia, which is extreme high blood pressure while you're pregnant. And when that happens, unfortunately, we have to monitor you closely, and then like you said, the baby has to be induced because it's
yeah,
an
because
emergency.
with my daughter, I couldn't breastfeed. So up until now, I'm still on medication
Yeah,
for it. So
yeah,
yeah, so
yeah. And this happens not on any fault of your own. It's just what our bodies consider stressful. So just like
mhm,
we have autoimmune diseases, so sometimes our body attacks itself. Sometimes depends on what's happening. Our body can do whatever it thinks it needs to do to help us survive. So as our stomach grow and all this resistance is happening in the body, it will make our pressure go up, like you said.
mhm,
It can make our sugar go up. And why it's doing that? No, because there's so much pressure. There's not enough, like your body, the circulation is not happening. So there's pooling of
yeah,
fluids. So your peripheral arteries, which is the arteries that supply the bottom part of your
mhm,
feet, right? There's not enough proper circulation. So the pooling of fluids happens there. And because of that happening, there's pooling of fluids all over your body. And then
yeah,
your heart is overwhelmed with all the fluids that it needs to pump around. So
yeah.
in doing that,
Luckily, my heart was able to go back
thank
to
God
its
for that.
normal
Yeah,
station,
yeah,
but they told
yeah,
me that 50-50 chance that I
yeah,
would end up going through something like that if I
yeah.
get pregnant again. Or yeah.
Yeah. So in your case, then when you're so in that case, when you're trying to get pregnant, you plan your pregnancy, right? And then you make
Mhm,
sure that you're seeing your cardiologist before um, all this happens, and then they're monitoring you very closely because
yeah,
you're right. It becomes part because when something happens, it's not like it's genetics, just like how your body's built. It could happen again, and when you're being monitored, then medications is there to help with the fluid
yeah,
retention, right? With improve the circulation to make sure that you're safe and the baby's safe, right? So
yeah,
those things do happen. And I'm really glad you brought this up because sometimes when we're pregnant, um, but then they just take it as just like that, right? So unasia tata means you have edema, and the edema is a sign that your blood is not circulating properly and you're having pooled fluids, right? So
yeah,
when that's happening, those are early signs. So it's very important that you get it checked, right? And
yeah,
sometimes some people just have that, and then that's as far as it goes. But
yeah.
it's always a good idea to get yourself checked to make sure that
Mhm.
you're safe and your baby's safe because
Yeah,
preeclampsia, it just happens, and really there's no medical like it just usually people that it happens to, they don't have high blood pressure prior. They were
yeah.
fine, everything was okay, and then they go into pregnancy, and with all the hormonal
Yeah, it
changes,
happened. Yeah, it happened to me. Like I was
yeah,
okay from like beginning, and then towards the end is when my
yeah,
blood pressure just went high and
yeah,
all
yeah,
that stuff
yeah,
came to go. Yeah.
yeah. Yeah. So this when that happens, that's medical emergency that you need to take care of. But then
Mhm.
the same things that I talk about, right? So because when we're pregnant, our body is very stressed. So
Yeah,
then when we're pregnant, this is not when we don't need stress on top of stress, right? So it
yeah,
just makes things so much worse for us. So when you're pregnant, make sure that you're exercising, right? You're walking around more, you're doing some exercise, because that all helps with circulation. Making sure we're not sitting for so long. And if we're sitting, that we have our feet up to help reduce the swelling, to help your body use the like pump your heart, pump blood better that way. So these are all little tricks that we can do for ourselves, making sure that the foods that we're eating, we're not adding too much salt to it, because whatever salt, when sodium makes our sugar, our pressure go high. So the more sodium you eat, so the high salty foods that you eat, the higher your blood pressure will become, right? So, and so when you're cooking, in our cooking, we should try to add in herbs. I always talk about herbs and you know, like spices. We should use that to cook, but when we're using it, we should use natural ones. So we should refrain from all the Maggi and the onga and all those adobe, like all those are just very high salted foods that when you add to your healthy cooking, you're pretty much destroying it with the salt, right? And that will make your pressure go up. So when we're cooking, we should be mindful that we're using things to flavor our food nicely, but we're not causing harm to our body, right? Because all of that, if you're someone that have high blood pressure and you're adding all that into your food, that makes it go even higher, right? So I'm so glad you shared your story. Thank you. Because this is a teaching point for everyone that if you are pregnant, even if you're the healthiest before pregnancy, anything can happen. So be mindful, know your body. Anything that it's a symptom, have it looked at, because pregnancy is a short time. This is not a time to play around. You want your baby to be healthy, and you want to be healthy as well. So thank you so much for sharing your story. I appreciate that.
Okay, thank you very much. So the next question is wild rice better than white rice?
Okay, so wild rice is better because it has more fiber. Brown rice is better than white rice because it has more fiber. Because the white rice, sometimes through the processing, they remove the fiber from it, right? Through that processing. So white rice is better, wild rice is better, hard-boiled rice is better because all of it has a lot more fiber than white rice, because the white rice has very little fiber. But having said that, if you are someone, because some people, you can't, remember this is lifestyle changes, right? So I'm not gonna say only eat brown rice if you absolutely hate it and it's gonna make you throw up. That's not what I'm asking you to do. You can still have white rice, but if you choose to have white rice, make sure you're pairing it up with a lot of vegetables, right? Because you're getting fiber from the vegetables. So when you pair up the white rice with lots of vegetables, you're getting the fiber through that way. So even though the white rice itself doesn't have the fiber, because you're eating it with, you're pairing up with lots of fiber from the, you know, like let's say from your protein foods, from plant source and your vegetables, that helps your body still get the same benefits, right? So it's how you're placing the food. If you absolutely hate all rice and white rice is all you can do, then you have to include your vegetables and include your other grains and starches that has a little bit more fiber, right? So it's up to you. Brown rice is better, wild rice is better, but remember, it's the same amount. So just because it's brown rice doesn't mean you can have more. You still have the same amount, but it's better for you because you get more benefit from it that way. Yeah. Okay, any more questions? You can unmute yourself and ask questions or you can type in the chat if you don't want to, if you don't like to talk.
Hello.
Yeah, hi.
Yeah, so how much nuts can I have? Because I'm somebody that I've been snacking a lot on nuts, and I like it, but I think it's just making me become so a little bit more fat.
Yeah.
Just gaining too much weight.
Yeah, so nuts, right? So nuts are protein. They're very good for you, but you're right. They also have, they have some nut fat in it, right? It's good fat, but fat is still fat. It can still make you gain weight. So in terms of nut, it's handful. So if you make so not handful in terms of your whole hand. Like if you have your handful, or let me see if I have, so if, for example, if you're counting the nuts, things like 12 almonds or 12 cashew nuts, it's considered one serving of nuts, right? So it's not a lot, it's very little. So a little handful is considered a serving, right? So you want to make sure that you're not overdoing it, because you're right. overdoing the nuts can lead to weight gain, even though it's good for you. It's like avocado, it's great for you,
Yeah.
but if you overeat it, it can lead to weight gain. And when you gain weight, that can make you, that can indirectly make your pressure go up and indirectly make your sugar go up, right? So you want to have the nuts, but handful. So a handful of nuts is considered a serving. If it's nuts that you can count, no more than 12 the big ones. You know how some of the nuts are really big, no more than 12 per at a time. So that's per snack. So, and you're allowed to snack, let's say, if you're choosing to snack on protein, you can snack in between breakfast and in between lunch and sometimes before you go to bed. But it all depends on your weight. So if weight loss is your goal, then you want to reduce your snacking and then have a little bit of nuts. And if you're having the nuts and weight loss is your goal, you don't really have to add any carbohydrates. You don't have to add a piece of fruit or yogurt or something. You can just have the nuts because nuts has some carbohydrate in them, a little bit of carb in them as well. So
Thank you so much.
Yeah, no
Thank
problem.
you.
Hi, Julian, it's made. I just wanted
Juliet.
you, as you were explaining, can you touch up a little bit about the use of alcohol and also alternative alcohols such as red wine and the benefit of red wine? Because Ghanaians, we are very sociable. You know, we're social people. We like to drink a lot.
Yeah.
So just the benefit of the other alternative. I tried to explain that to my dad, and last time I was there, it was a
Yeah.
gallon of wine instead of maybe a glass of wine. So
Yeah.
if you can just touch
Sure,
that.
that's thank you, Mavis. That's excellent. So that was part of the. So can you see my screen? I'm sharing my screen about the alcohol. Can you see it?
No.
No.
No, you can. Okay, let me see if I can share my screen again. Can you guys see my screen now? No? Are you seeing my screen? Oh,
No, I
still
think
no?
maybe the host should give you some.
Yeah, can you give me the can you make me co-host so I can share?
Yeah.
Please. So Mavis, that's a very good question. So in terms of alcohol, right, the amount of alcohol you can have depends on the alcohol, like how much alcohol is in the drink, right? This is why I would love to show this if I can get the privilege to share my screen so you could see what's considered a serving of alcohol. But having said that, so when you are drinking alcohol, it's the amount of alcohol, the alcohol in the drink. So for example, if I go to have wine, I'm allowed to have, you know, a glass, if it's a glass of wine and it's, let's say 12% alcohol, I'm allowed to have the normal wine glass, like five ounces, right? 5 ounces, which is not a full glass. It's almost like a little bit more than half, right? I'm allowed to have 5 ounces because it has 12% alcohol. If the wine is, let's say 17% or more, because now it has more alcohol content in it, then I have to have less. And it keeps going until you hit the hard liquors. Things like things that have 24% of alcohol or 40% of alcohol, like aperitif, all those things, you know, you have to have less, right? So when you have alcohol, depends on the amount of alcohol content in the drink, you have to have less. If it's hard liquor, you can't pour a wine glass and drink hard liquor because that's too much alcohol. If it's wine and it's 12% or less, then you can have a little bit. If it's beer only have 5% of alcohol. So then you can have 12 ounces, right? So 12 ounces of beer, like in terms of the amount. So it depends on how much. But in general, one sec. Okay, so in terms of alcohol, the general rules is if you're going to have alcohol, right? So think alcohol, like let's say you drink beer, you should be having no more than, for men, no more than 14 drinks per week, and for women, no more than 9 drinks per week. So if you classify it in terms of the number of alcohol, so if you're going to have alcohol, no, for men, no more than 1 to 2 drinks per day. If you're someone that drinks. If you don't drink, please don't start. I'm not saying, you don't say, Juliet said you can have 2 drinks, so I'm gonna start having 2 drinks. That's not what I'm saying. If you're someone that drinks already, and you're drinking more than that, then you need to reduce it. So you're drinking no more than 2 drinks per day for men. And for women, no more than 1 drink per day, right? Because we need, if you drink within that limit, then it decreases your chance of getting Alzheimer's disease, hypertension, and all the other things that can come from alcohol. Because alcohol is empty calories. It's not, it doesn't have much benefit for your body. It makes you gain weight, and it makes you gain weight around the belly. And when you gain weight around the belly, that's when insulin resistance happens. That's when your blood sugar starts to go up, your blood pressure starts to go up, and then you can start to build cholesterol into your arteries, right? So when you're drinking alcohol, if you're someone that drinks more than 2 drinks per day, please try your best to reduce it to no more. If you're a woman, no more than 1 drink per day. If you're men, no more than 2 drinks per day. But in a week, no more than 14 drinks for men and no more than 9 drinks for women. So if, and this is not something you can save up either, right? Just like if you're taking medication, you're not going to hold all your blood pressure medication and take it on Saturday. Same thing goes for alcohol. You're not going to wait and say, Juliet said I can have 14 drinks a week. So I'm gonna, on the weekend, I'm gonna have my 14 drinks. That's not it. You can't binge drink, because when you binge drink, meaning that you drink large amounts at a time, it can affect your cognitive, meaning it can lead to Alzheimer's disease later on in life. It can lead to high blood pressure, cholesterol, and all of that, right? So everything we do, we have to do it in moderation. So if you drink alcohol, that's okay. That's your prerogative, but do not go above the recommendation, because that can lead to so much problems for you later on in life. Okay, and I'm not sure if my screen is still.
So, Juliet.
Yeah.
I think the sum total of your presentation is that we are better off without alcohol, because
Yes,
it's really not beneficial.
It's not really beneficial. It's not. Like, I mean, you know, people like to socialize, and when they socialize, they like to drink and they think it relaxes them. So alcohol is a stimulant. So it will make you feel like that, but then it's going to crash later on and you're going to feel pretty terrible, right? So if you don't have to drink, you don't need to drink. But
So
if
as a church, we usually advise broadly that Church of Pentecost members, we are no alcohol policy. We have no alcohol policy. So as far as the church is concerned, as a member of the church, you basically are not expected to be drinking at all.
Yeah.
So that's basically
and that's a good policy.
So that's great. And that's our teaching. And if we can all follow that, that's excellent. It's good for you. It will prevent so many issues later on in life in terms of your health. But I know some people still drink. So if you do drink, our goal is for you to not drink. But if you do drink, please be mindful that this is not something that is going to benefit you later on in life. If you do drink, drink with it, because studies have been done with people drinking in this alcohol moderation, and it's you know, like in terms of illness and diseases, you have low chance of getting those kind of complications. So if you're going to drink once in a while, that's fine, that's your prerogative, but do not binge drink. The binge drinking meaning having a large amount of alcohol all at once, because that affects your liver, because your liver is what processes alcohol, and you need your liver for cholesterol management. You need your liver for example, when one of the aunties asked me, when you have diabetes, your sugar can drop too low. When you drink alcohol, alcohol can make your blood sugar drop low. So that's for people that have diabetes. Please be mindful. If you drink alcohol, alcohol can work to lower your blood sugar 24 hours after you drink. So let's say I had an alcohol right now, it's still gonna be working to and can affect my blood sugar 24 hours from now, right? So it can make your blood sugar go dangerously low. So if you are someone that have diabetes, if you're going to drink alcohol, it's better to have it with your meal. So have it when you're having, let's say, your dinner or your lunch, because then you have carbohydrate on board, because you're getting the sugar released from the food that you're eating. If you drink on an empty stomach, that can cause low blood sugar, that can lead to alcohol poison. Sometimes Ghana is still that's what it is. It can cause hypoglycemia, where your sugar go too low, you can pass out, and God forbid, if you're not found early, you could die. So just be mindful that if you are going to drink, you drink. If you're someone that drinks and you're going to have it with food, going to drink, have it with a meal. Never drink on an empty stomach. And that when you have alcohol, be mindful that your sugar can drop. So keep close eye on your blood sugars so it doesn't go too low to harm you. So very important to know that if you have diabetes.
Thank you very much. So the next question is, you mentioned about, yeah, there's another question. So it says, you mentioned about yogurt during the presentation. Is there a specific yogurt for diabetes? For example, Greek yogurt is better, or is there any other better yogurt out there that is not too sugary?
Okay, that's a great question. So yogurt is made from milk, right? So yogurt, milk, kefir, they're all in the same group. So these foods has natural sugar in them. So the yogurt itself and the milk itself have natural sugar in them. So when you eat them, you get energy from it. You get sugar from it, whether it's sweet or not. But there's difference in terms of the Greek yogurt that you mentioned, because the Greek yogurt is much thicker, it's high in protein, and it's no sugar is added to it. So it's just the natural sugar that's from the food itself. So when you eat yogurt, natural yogurt, it's better for you than eating yogurt that's flavored, right? Having said that, natural yogurt, some people don't like it because it tastes pretty bitter, right? And it doesn't taste good. So what I recommend is, if you're going to have yogurt, you can buy, if you want a really good yogurt for yourself. The Greek yogurts are good because they're thicker, they're high in protein. So then you can add your own fruit to it, right? So you can use things like berries, like strawberries, blueberries, raspberries, and to flavor your yogurt, if you like, right? So then you're getting all natural sugar, so there's no added sugar. If you're buying yogurt at the market and you want one that's already flavored but also safe for you, any yogurt that says no sugar added is okay. It means that they didn't physically add any more sugar to it, right? So whatever sugar's in them is what is coming from the yogurt itself, the natural sugar. So anytime you're buying yogurt, if it says no sugar added, that's great, you can have it. And then in terms of the flavoring, sometimes when they're using fruit to flavor it, so if you use your own fruit, obviously you're not going to add sugar, white sugar to it, right? But sometimes when they flavor the yogurt, they add sugar to it for it to taste sweet. So if you're buying yogurt, the vanilla yogurt usually has less sugar than the other flavors because they don't have to add so much fruit to it, right? So vanilla yogurt is fine to have. Any yogurt you like, you can have. What I recommend, you can buy the plain yogurt, you can buy one container of plain yogurt and one container of your favorite type of flavor yogurt, and then mix it up. Right, so this way you have less of the sugar from both, and then you still get the benefit of the yogurt, right? Or you can just flavor it with your own fruits if you choose to. So, or you can buy the yogurt that they use artificial sweeteners. So you know how some of the yogurt has like artificial flavor. So they have like, they use Splenda or Sugar Twin or whatever to use it as the main sweetener. Those are fine to have because your body cannot process that artificial sweetener into sugar in your body. So it's not going to cause your blood sugar to go high. So if you choose to, you can buy, they call it like a diet yogurt. So a yogurt that has not been, they use artificial sweetener and then mix it up with the regular yogurt to get the flavoring. Okay? Does that answer?
I have a question.
Yeah.
Hi, Juliet, I have a question here.
Sure.
This is Evelyn.
Hi, Evelyn.
My question, okay, can you please elaborate on the skincare for people with diabetes, especially when it comes to having wounds or any kind of sore or anything? Can you please give a little bit of education on their skincare?
Okay, sure. That's an excellent question. So when people have diabetes, right? So like I said earlier, some of the symptoms of diabetes is that you're peeing a lot and your body's pulling lots of fluid because your liver is trying to clear all the sugar from your system, right? So in doing that, it dries your skin. In doing that, you become more thirsty, and when you're more thirsty, you're more dry, and your skin can get very irritated easily. So most people that have diabetes can have dry skin. So if you have dry skin, just like your normal regular skin, you just use regular lotions. So you don't have to buy things that have like any formulated special chemicals. It doesn't do it. So just regular lotions that you like. Of course, stay away from lotions that have a lot of perfume. So lotions that are very scented, usually they have a lot of chemicals and perfume in there, and that could irritate the skin. So stick with things that have that are natural, like Aveeno, or things that they use the oat base to make like those kind of lotions, or Vaseline, right? Like use Vaseline. Anything that moisturizes the skin is fine without having so much perfume in it. And then in terms of skincare for your feet, that's where the problem lies, because when you have diabetes, like I said, there's nerve damages. So sometimes when people hurt themselves, they don't even realize that they hurt themselves. So you can have a cut, and then because bacteria love sugar, the bacteria hangs around, and then it can turn into a big wound, which later on can lead to amputation, right? So in terms of foot care with diabetes, it's very important when you have diabetes to look at your feet literally every day. And when I say look at your feet, I mean physically look at your feet every single day. Make sure there's no scrapes or cuts on your feet. If there's calluses and corns and things like that on your feet, don't try to take care of it by yourself. You have to see a chiropodist, which is a foot specialist, and they can clean that for you. So if you have, let's say, like a bump or a bunion or corn or anything like that on your foot, please don't try to do it yourself, because you can cut yourself without knowing. You can damage your skin without knowing, because remember, your sensation for the sensation to feel pain has gone down because of the sugar. So you might damage yourself. So it's better if you have diabetes to get your feet checked once a year. So if you have diabetes once a year, you have to go in for a diabetes educator to take a look at your feet. You will do a nerve test to make sure that there's no nerve damages. And if there are nerve damages, can we mute everyone now? Just while I'm explaining this, because this is very important. Yeah. So when you have diabetes, when you're taking care of your feet, you wash your feet normally like you do, like you shower. And then in between your toes, never put lotion in between your toes when you have diabetes. Because when you put lotions between your toes, it can lead to fungal infection. It causes increased moisture, and increased moisture can lead to fungal infection and all kinds of infection. And when you have infection, that makes your sugar go down. So foot care with diabetes is you clean your feet normally, you put your lotion on your feet, but don't put it in between your toes. If you are someone that walk barefoot around the house, make sure when you have diabetes, you wear slippers or you wear socks when you walk around, because you can hurt yourself without noticing. You don't want to step on anything. So always make sure that you have footwear, very important. And if you do have a cut, you take a look at it, you clean it up to a week. If it's not healing, you need to see, you need to get some ointment from your doctor or from a chiropodist to put on there to increase the healing process, because a small little cut can lead to a big foot amputation later on in life, right? Because your circulation is much poorer because you have diabetes. Your sensation is much lower because you have diabetes. So make sure that if you are someone with diabetes, you're taking care of your feet and that you're looking at it every day. And if you're going to cut your nails, you cut it straight. Don't do no fancy nail cutting, just cut it straight. Do not, please, if you're going to go to a salon to get your nails done, as an educator, I would advise you not to get pedicures and to get like your feet clean at a public place, because that increases your chance of getting fungus infection and all of that. So clean your feet at home if you can, and make sure that you are cutting your nails. If you have ingrown toenails, so sometimes your nail grows into your skin, do not try to dig it out yourself. See a chiropodist and have them take a look at that and do that for them, because they have special equipment that can help them get rid of that, because you can cut yourself, and a little cut, I can't stress that enough, can lead to a big issue, huge problem later on in life that can cause amputation. So I don't know if that answers your question, Evelyn, but foot care is very important. Just take care of your skin like you normally would. Just avoid putting cream in between your toes. If you're someone that sweats on your feet, make sure that you keep your in between your toes very dry, so that you don't develop any kind of fungal infection or any kind of infection, because any infection you get when you have diabetes will make your blood sugar go very, very high, because bacteria, like I said, hang around more when you have diabetes. And the same thing goes with mouth care. Also, mouth care, your mouth becomes very dry when you have diabetes. So make sure that you're drinking plenty of fluid, and that make sure that you are, brushing your teeth twice a day, you're flossing, you're doing all the normal things that we tell everybody to do, but keep an eye on your mouth. If you start to see like red gums or bleeding gums or sore gum, see your dentist, and make sure that you're following up every 6 months at least to see your dentist to get mouth care, because when you get some of the mouth condition, it can lead to heart disease. So mouth care is very linked to your heart disease. So if you're getting a lot of gingivitis and a lot of mouth issues, it could be a sign that you're, there's something going on with your heart. So it goes hand in hand. So just be mindful of that. Like everything that you do, you know, you take a look at it. You don't become paranoid and, you know, you run to your doctor every time, but be mindful that these things happen for a reason, and your body, whenever there's symptoms, that's your body warning you that something is happening, that you listen. Okay. Evelyn, did that answer your question?
Yeah, you did.
Okay, thank you. And also, is there, if there's, I want to just mention about, I know I did get a lot of questions to talk about this, like sexual health. So, and I won't go into detail. So if anybody have, you can always call me and then we can have our own private talking. But just be mindful that diabetes does affect your sexuality. It's for men and women. Women, it leads to a lot of, you know, yeast infection and all of that, vaginal dryness, all of that. And for men, it can lead to erectile dysfunction. So if you're taking care of your diabetes, it takes care of all of that, right? So things that you're doing to manage, like the exercise you're doing, the watching your diet, making sure that you're controlling your alcohol if you drink, to drink in moderation, to control your stress, all of this help protect all the muscles in your body, right? Including, for men, including their penis. So you have to be mindful that whatever you're doing to take care of the big muscle, which is your heart, also takes care of your muscle down there. So this is all part of diabetes management. And if you do see that, you know, you're starting to have that problem, it's better to speak to your healthcare provider early, so things could be done to help you. So don't wait till things are kind of out of control, because there are things out there and a lot of people go through this and people live healthy, like I said, healthy, normal, functional life with diabetes. So if you start to see problems, seek help early so things can be done to help you sexually, to you know, prevent any further marital problems down the line for you. Okay. So I'm open for any more questions if anybody has any.
Hi, Juliet. I have a question.
Sure.
When we were talking about exercises, you mentioned that taking walks is good. It's good. And what I want to ask is, if you are someone that does a lot of walking at your workplace, you do a lot of movements, both at home and at work, can that be considered as a form
of exercise? Okay, that's an excellent question. So what happens is that, so for it to count as exercise, it has to be something you're doing apart from your regular life. So when you work and your work is very active, so you're walking back and forth, that's really good for you. It's very excellent for your mental health. But when we talk about exercise, it has to be something you're doing on top of your normal routine. So for example, if my work is very physical and I go to work and I do a lot of walking, that's great, but I still should aim to get my half an hour walking, about maybe not every day like everybody else. For some of us that work and our work is not very physical, if your work is not very physical and you're sitting a lot, then your 30 minutes that you're doing a day is good enough, but that's the minimum. So for someone that is already physical at their work, they're already getting a lot of benefit from all the movement they're doing. But for it to count towards your exercise goal, it has to be something you're doing on top of it, right? So then for someone like yourself, if your work is very physical, then meeting the minimum of 150 minutes is good enough to keep you healthy. And for some people, even help you lose weight. But if your job is very sanitary, where you sit a lot, you don't do a lot of physical activity, then your minimum is the 30 minutes a day, but then you aim to go higher because that's the minimum, right? The more you do, the better your health becomes. So if your job is already physical, then that's excellent. Keep that and then add the minimum on top of it. But if your job is not very physical, then aim for the minimum. And then once you get stronger, keep going to improve your overall health. Yeah.
Why?
Hi, Juliet.
Hi.
Yeah, I have a question. I've heard that egg have cholesterol.
Please, if you're not talking, can you please put your phone on
mute? Can you mute yourself if you're not the one talking, please? Thank you. Go ahead. Go ahead.
Yeah, I just want to find out whether eating egg every day is okay, because some people say that egg is high in cholesterol.
Okay, yeah, that's that. So if you're someone that has, so cholesterol, to explain, cholesterol, 20% of the 20% is influenced by our diet, right? So our body makes cholesterol. Our own body makes cholesterol because it uses it for cell membrane and other functions in our body, right? So our body makes cholesterol. 80% of it is made by our body. 20% of it is influenced by our diet. So if you were to look at the overall, if you eat egg a day, it's not going to make a huge impact on your cholesterol health. Because I know at one point they said, stay away from egg, it's not good for you. Egg is a complete protein. There's nothing wrong with egg. And the cholesterol part, where the cholesterol is found, is in the yolk, the egg yolk. So if you're going to eat 1 egg a day and you're not someone that has high cholesterol, where you're taking medication for cholesterol and everything is okay, that's fine. There's nothing wrong with that. Having said that, if you're someone that already have high cholesterol, right? So like your doctor said, your cholesterol is going up, be mindful. You're not taking medication, just, work within your diet to try to improve your cholesterol. Then I'll recommend that you can have 3 eggs a day. 3 eggs a week, but you can have an egg a day, right? So for example, you can have egg white every day if you choose to. So you can have the egg white. If you boil the egg, you can take the cholesterol, the yolk out and eat the egg white, because that's where the protein is, right? And then avoid the yolk. So you can have that every day. But if you want to have a whole egg, then you can have it 3 times a week, and that's good enough. So you can have it, let's say, I don't know how you choose, Monday, Wednesday, whatever.
Sunday.
Egg, and then the other times you can have white eggs. If your doctor has warned you that, be mindful with your cholesterol. But it's not just, but everything else too. So if you're eating a lot of vegetables and lots of food with fiber, that also help with cholesterol management, right? So I usually don't tell people to stay away from egg, because egg is a complete protein. It's very good for you. It's one of those proteins that your body is very hard for your body to digest, meaning that you use a lot of energy to break it down. So it's a really good protein to have, but just don't cancel your egg. Have your egg every day. If you're taking cholesterol medication, if you're taking cholesterol medication for, and your cholesterol is is fully managed and there's nothing wrong with, your cholesterol level, then you can have 1 egg a day. There's nothing wrong with that, but be mindful. So it all depends on where you're at, but there's nothing wrong with eating egg. And always remember, 20% of your cholesterol is influenced by your diet. So the other half is what's happening in your body. So sometimes you do the diet very well, you're exercising, you're doing all that. If your cholesterol still happens to be high, don't think that you failed. It's just like everything else, it has a genetic part of it. So then you have to speak to your doctor and see what can be done to help you manage it, through medication or other means. So don't sit there and let the cholesterol just keep happening, because then that can lead to heart disease and other things.
Okay, thank you.
No problem.
Quick question.
Sure.
So Juliet, at what point can you ask your GP to refer you to a specialist? Because I know that most people are still with their GPs, but having much problems with diabetes, which is affecting most parts of their systems.
Yeah.
And to put this across, we also have so many researches than different medications that can, from your teachings, at what point can you ask your GP to refer you to a specialist like neurologist to help you with your diabetes problems?
Excellent question. So at any point, so when you have, and I come across this a lot, because sometimes by the time the patients, they come to us, there's so much that could have been done that the GPs didn't do, right? And it's not like, sometimes it's not neglect, it's just they're working within their target. So at any point that you have diabetes, you can request to see an endocrinologist, which is a diabetes specialist, right? So an endocrinologist is a diabetes specialist. So they take care of your diabetes. So and remember, diabetes affects everything. So they're taking care technically from your head to toe. So they're doing the assessment, and anytime they find any kind of issue going on, let's say now you did blood work and now they found that there's something going on with your kidney, then they can refer you to see a kidney specialist. Your GP can do the same thing. So not all GPs are the same. Some of them do excellent jobs. So even if you don't have an endocrinologist, as someone with diabetes, you should have a diabetes educator as part of your team, because the diabetes educator's job is to make sure that you're being looked at from head to toe. And anytime that there's neglect going on, then it's my job to make sure that everything is put in place for that client, right? Because, for example, there's so many medications out there that can help a person. So if someone have diabetes and their blood sugar is so high, and when you have high sugar, it's affecting your overall health and it's killing you slowly, then it's my job to make sure to tell the doctor, this medication is not working. I want you to start the client on this and this and this medication because of the benefits that it has for the client. So even if you don't have a diabetes doctor like an endocrinologist on your team, you have to have an educator on your team because they are the ones that are working with the GP to connect in terms of the medication, the resources out there, and to make sure that you are being looked after from head to toe. So anytime, at any point you feel like you're not getting the help you need, you have to ask for the help. So ask your doctor, I want to see a specialist about my diabetes. And once, because you have diabetes, that's the angle you go. And if they have you see that specialist, that diabetes and endocrinologist do a blood work and do the assessment to see where you are in terms of your diabetes management. And if things are falling out of place, that's when they will refer you to see all the other different specialists that you need, like kidney specialists, the neurologist and the nephrologist and all the other specialists that you need. So, and your diabetes educator can refer you as well. So at least you should have an educator on board. And anytime you speak to your doctor and they say, well, I don't think this is a big deal, and you feel you are the one that's feeling the symptoms, you need to get the help you need. So, call an educator or call somebody to have you. We can get you a different family doctor that's willing to work with an educator to help you. Because sometimes some of the family doctors feel like they feel pressured because if an educator is on the case, there's so many things we're telling them to do, and some of them they feel like they're being monitored, right? So sometimes they don't like to work with educators, but it's your right to make sure that you get the help you need. So at any point, if your GP is not doing the job that you think, let us know, let me know, we can get you a different doctor that can take care of you, because you have to be in charge of your health, and don't put your health in the hand of your doctor, because they're people, and neglect can happen, and it happens all the time. And there's so much out there to help you, for you to be stuck with a doctor that's not doing anything to help you. So that's very important, Evelyn. Thanks for bringing that up. Yeah.
Thank you so much, Sister Juliet. God richly bless you. I hope no one has any question. Is there anyone with a question before we end the program for today? Do we still have anyone with any question?
I don't have a question, but I just want to say this is a fantastic section, and Mr. Juliet's doing a wonderful job. So keep it up. I'm so glad that I joined.
Thank you. Thank you. And at any point, if you have any questions, remember, my job is to help in the community as much as I can. That's my passion. So if you have any questions about anything, just reach out to me. Even if I'm not the one that could help directly, I can connect you to the resources that can help you, right? And then if you are here and you don't have your papers and you have diabetes, you can call me. I can connect you to get a doctor and get people to look after you, because the government knows that there are people here illegally and you still need health care. So connect, and then I'll connect you with the right resources to help take care of you, because we're all in this together. We're all one family, and we're here to help each other. So at any point, you can contact me.
Right.
Yeah, this is Pastor Amon. Can I chip in a little contribution?
Sure.
Yeah, we thank you so much, Sister Juliet, for the wonderful presentation. But I think once again, we want to stress very strongly that for us as believers and members of Church of Pentecost on this platform, we don't encourage people to drink alcohol. The Bible says in Ephesians 5:18 that do not get drunk with wine, for that is debauchery, but be filled with the Spirit. You read Proverbs 20:1, it says, wine is a mocker, strong drink is a brawler, and whoever is led astray by it is not wise. And then you go to Galatians chapter 5, where it talks about the works of the flesh. There also drunkenness is mentioned. And there Apostle Paul states it emphatically that those who do these things will not inherit the kingdom of God. Then we come to the fact that your body is also the temple of the Holy Spirit.
That's right.
And you cannot use it anyhow. So I just want to chip in so that people will not think that, oh, you can drink it in moderation. The Bible has a lot to say about alcoholism. So it's not a matter of just I'm drinking a little bit. It's for us, it's a no fly zone, so that people should take note of that. That as a church and as believers, we don't subscribe to that. That is my humble contribution. Thank you very much.
Yeah, so no drinking, because it, first of all, it's not good for you, and second of all, like your health, like and he's right, it doesn't do you any benefit in terms. I know sometimes people say, oh, drinking red wine has a little bit, you know, you can live a healthy, balanced life if you never touched alcohol. So you don't have to drink, and I'm not promoting that. You know, you should drink. If you don't drink, don't start. If you do drink, work until you can completely quit, because it will help you. It will help benefit your overall health. So I guess we'll close on this note, and if there's any no more questions, then I guess we're done for the day.
At this time, we are going to pray. The Bible says in everything we should give thanks unto the Lord. Pastor Amon, we want to say a big thank you for your contribution. We are going to pray. We are